Alzheimer's is arguably the most urgent health crisis facing certainly the United States and maybe the world as a whole.
Dr. George Bloom is the chairman of the biology department at UVA and a leading researcher in the treatment of Alzheimer's disease.
We're actually asking a very simple question, and that is what happens at the very beginning to turn a normal, healthy neuron, a brain cell, into an Alzheimer's neuron. It's now pretty clear to most researchers and neurologists that Alzheimer's begins about 25 years before symptoms become evident. There is an emerging consensus that you will never be able to cure Alzheimer's disease by beginning to treat patients once they're symptomatic. So if we're going to lick this crisis, we're going to have to start treating people many years before they become symptomatic. And that raises an additional challenge. How do you identify people who are at risk?
Research has determined that the risk of Alzheimer's disease is not the same for everyone.
If you have one copy of the ApoE4 gene, your risk of becoming symptomatic for Alzheimer's eventually is about 5-fold higher than it would be otherwise. If you have 2 copies of this gene, one from your mother, one from your father, the risk of showing Alzheimer's symptoms rise 10 to 20-fold. There's an example of what we would call a genetic biomarker that indicates people who are at much greater risk than they would be otherwise for getting Alzheimer's disease. But it's not an absolute risk. We're proposing to use people who are ApoE4 positive as the test group. The mantra in drug development for Alzheimer's is disease-modifying drugs, drugs that prevent or slow progression of the disease, as opposed to symptom-relieving drugs, which is all that we can offer right now. And they're just Band-Aids. You know, if they work at all, they improve your memory and cognition just a little bit for just a little while.
But the promise of an effective Alzheimer's treatment may be on the horizon.
We're now in the midst of designing a clinical trial for a drug called Memantine, but we just completed a study that's now being published in a journal called Alzheimer's and Dementia, which is the official journal of the Alzheimer's Association, showing that Memantine might actually be able to prevent or seriously slow down the progression of the disease.
The cost of Alzheimer's care nationwide is reaching crisis proportion.
Alzheimer's is the most expensive disease in the United States. Cost American society $260 billion in 2017, more than cancer, more than heart disease. That figure will rise to more than $1 trillion a year by the middle of the century if we can't do something to prevent people from getting Alzheimer's disease. You know, my hope is that I can contribute, my lab's work will ultimately contribute to whatever the solution for Alzheimer's disease proves to be.